Welcome, and thank you for joining us. IgG4-related disease, or IgG4-RD, is a serious and chronic immune-mediated fibroinflammatory condition that can affect multiple organs in the body. Because awareness of this condition is still low, many patients experience significant delays in diagnosis, and often, by the time they're diagnosed, some degree of irreversible organ damage has already occurred. In this video, we'll hear directly from two individuals living with IgG4-related disease, Kim and Donna, who share their personal journeys. Their stories highlight both the challenges of being diagnosed with a rare disease and the strength that it takes to keep advocating for yourself when answers aren't easy to find. We're going to talk about two main themes today. The first is about finding your voice, how speaking up, asking questions, and leaning on support systems made a difference during your journey to diagnosis. The second is about the emotional side of living with unexplained symptoms, misdiagnoses, and the uncertainty that comes from not having answers right away. Through these conversations, we hope to deepen understanding, inspire self-advocacy, and remind those living with rare disease that they're not alone. We're also honored to be joined by Dr. Al Friedman, a psychologist, consultant, keynote speaker, and father. For more than 2 decades, Dr. Friedman has worked with individuals and families affected by rare diseases, drawing from both his professional expertise and his personal journey as a rare disease dad. Welcome, everyone. Can we start out by having you tell us a little bit about yourself?
Hi, my name is Kim. I am an IgG4-related disease patient. I was diagnosed in May of 2023, and I live in a small town just south of Portland, Oregon.
Hi, my name is Dr. Al Friedman. I live in a suburb outside of Chicago called Northbrook. I am a practicing psychologist, and I specialize in supporting patients and families affected by rare disease. I came to this work because I'm a dad too, and my son Jack was born 30 years ago, healthy, but diagnosed with a serious and untreatable at the time neuromuscular disease called SMA, and expected to live only to the age of 2. But Jack lived to the age of 26. He passed 4 years ago, and he's the reason that I know a lot about the experience of living with rare disease, and he's the reason I feel, frankly, credible supporting other families and patients who face challenging circumstances as my family has.
Hi, my name is Donna, and I am also a patient with IgG4-related disease. And I was diagnosed in July of 2023, and I live in a town on the New Hampshire border of Massachusetts, just north of Boston.
So, first question. Can you describe the first time you realized something was wrong with your health and how you brought it up with your doctor?
So the first time that I realized something was wrong with my health and how I brought it up to my doctor is kind of unique compared to most people. I was at work and ended up with acute onset of abdominal pain that led to nausea and vomiting. So my situation, unfortunately, I didn't have many symptoms leading up to my diagnosis. I was put into a situation where it was an emergency and we had to act quickly.
Thanks, Kim. Donna?
The first time I realized that something was wrong with my health and brought it up to my doctor was pretty vague, probably because I was having symptoms of kind of upper gastric issues after I was eating. I was noticing I was having some pain. And so I had assumed that I was probably having some gallbladder issues. So I had called my primary care and spoken to them about that, and they agreed to do a CAT scan just to kind of see, what was going on. So my whole process started with something completely different than what it ended up being. And, in the long run, I didn't really have any symptoms of what ended up being the IgG4-related disease in the end.
Thank you for sharing that, each of you. So I'm going to ask you next about what role did persistence play, or asking the right questions, and finally getting a diagnosis? Like, how did you have to self-advocate? Did you? Okay, so we'll start with that same order if that works. So Kim?
So like I spoke on earlier, my situation was pretty unique in the sense that I was in an emergent situation with a bowel obstruction and subsequent perforation. So things happened really quickly without me having to actually advocate for myself. We did end up getting a biopsy of a mass that had caused my bowel obstruction. And after that came back as non-malignant. Fortunately, I had a good doctor who was like, let's get a second opinion on this, and referred me to a teaching hospital in Portland. So I was able to, with the help of my own physician locally, get referred out to see specialists. So I was really fortunate to not have to do a lot of that legwork and advocating for myself, which I know is not oftentimes the case with an IgG4-RD diagnosis.
Thank you. Thank you for sharing that. And I'm sorry that you guys have gone through all of this to get the answers that you needed. I know this has been hard. It's probably hard to talk about too, Donna. Can you go next and share?
I really had to advocate for myself in the, kind of the long road and short road at the same time that it took to get to the appointment with the actual diagnosis, because my symptoms were not there when everything started, and then ended up that the IgG4-RD had caused so much damage to my kidney that I ended up having to have surgery to remove my kidney. And it wasn't until that surgery, when they opened me up and saw that I was full of this fibrotic tissue in my retroperitoneum and into my pelvis, and the doctors had never seen it before. And, had kind of postulated that, it might be retroperitoneal fibrosis. And I found my way into the specialty clinic that I go to, who also deals with retroperitoneal fibrosis and IgG4. And I remember, having that appointment and saying to the doctor that specializes in this, I think that's what this is. And he wasn't convinced because, he hadn't read the operative report yet from my surgery. Everything else, my scans, the biopsies, even though the biopsies had come back with IgG4 in it, it wasn't quite to the threshold that there's a threshold of it has to be greater than 40% of the cells and stuff like that. It wasn't quite to the threshold of diagnosis, and I didn't have any of the symptoms, all that stuff. And until I said to him, I said, did you read the report from the operation that the surgeon did? And he said, no. And I pulled it up. And when he read the report, how the surgeon described what he saw and how much of the tissue was involved, he just stopped and he said, oh my God, this is what you have, because you have retroperitoneal fibrosis, IgG4, and this is an emergency. We need to treat you now. I'm glad that I said, did you read that report? I think, that's something that a lot of people probably wouldn't do. I'm a nurse, and so I understand, how to read reports and the information to give, doctors, and doctors only know what you tell them from us. So, I just wanted to make sure that he had all the information before, he decided that either we were going to watch and wait this thing out and see what was going to happen, or I was going to be treated and kind of come to a diagnosis. And it was from advocating for myself and saying, did you read everything? And did you look at this? That I actually got the diagnosis.
Wow, it's incredible. I remember when I spoke with you last year, you said it's important for patients to ask all the questions. And that really resonated with me. Ask all the questions. How did support from family, friends, or the patient community or communities help you during your diagnostic journey? So when you were trying to figure things out, what kind of support did you have? And so you can reword that any way you want, and I'll let Kim take over.
Awesome. Support from family, friends, and the patient community were extremely pivotal and continue to be during my diagnostic journey, and now as a patient fully diagnosed. Initially, my wife, who is also my caregiver, was my biggest support. She sees firsthand everything that I'm going through. She was there at all of my appointments, all of the appointments that we didn't get information at, people kind of shrugged their shoulders. We don't know what's going on. She was there for all of that. And then I'm fortunate to have my parents that don't live too far away. So when I was initially very ill, they were able to come down and be an added support system for both myself and my wife. Additionally, I became involved in some of the online communities that I found through Facebook and then eventually the IgG Forward Foundation. And this was one of the biggest support systems that I've been able to establish is through online communities, in-person events, and I've been able to connect with other IgG4 patients who some of which I talk to on a daily basis. So a combination of really my wife, my family, and then new connections that I've made through online and in-person events have really been pivotal in helping me during and after my diagnostic journey.
Thank you for sharing. Thanks, Kim. Donna?
The support that I received as I was going through this process up to diagnosis and beyond was really primarily my family. My husband, my sister, my dad was massive because the process leading up to diagnosis was full of uncertainty and worry. And, when you hear that they think you have cancer and, all of the stuff that comes with that, going through that process is just horrifying to begin with. So, that was, traumatizing on one end. But I got a lot of support from my family at that time, and my friends. But I mean, it was really like I kept a lot of that close to me. And then as things evolved, and thank God, was not cancer, and we moved on to the phase of like, okay, it's not that. What is it? And the exploration of the IgG4 world and everything that brought me to, the online community, and then. That led to meeting people online who were like me, and had similar stories. When you can look at somebody else and talk to somebody else and touch somebody else and say, oh my God, you have the same thing I do and you have a rare disease. That's really a blessing. And it really does so much, for you spiritually, mentally, emotionally, to know that you're not alone.
Thank you, Donna, for sharing about the importance of support from family, friends, and patient communities when you're going through a diagnosis. So now I'm going to shift over to Dr. Friedman. From your perspective, what are the most common emotional and psychological challenges that patients with rare diseases like IgG4-related disease face during their diagnostic journey?
It's a very complicated journey psychologically and emotionally for patients like Donna and Kim and so many other IgG4 patients I've worked with, both individually and in groups, and other rare diseases that are ultra rare. If we think about it, we have our lives before we have symptoms, and then we have a part of our life where we have symptoms, but we don't know why we have them. What are these symptoms about? What's the source of them? We don't know what they're about. We're not diagnosed yet. And then there's the part of our life where we have a name for the condition, and then we can move on with that information. As a psychologist, what I can tell you is that the journey can be very traumatic for patients, filled with confusion, filled with uncertainty, filled with worry and anxiety. Those symptoms, understandably, morph into anxiety symptoms, anxiety disorders that are also diagnosable. There's the life we have before all this happens and the life we have after we have a rare disease diagnosis. The diagnostic journey is a no man's land, which can be really scary and can be very disorienting and very frustrating. Because if you think about it, the other question you asked earlier, what are the right questions to ask of a doctor? If you don't know what the disease is, you don't necessarily know what questions to ask. You don't know where to start. And 99.99% of people in the world don't know anything about IgG4 or that it even exists. So no one's heard of this. No one knows about it. And it's like a needle in a haystack.
Thank you, Dr. Friedman. What advice would you give to patients when they're advocating for both their medical and their mental health needs, as you brought up, when they're navigating a complex and rare disease like IgG4 related disease?
The advice I offer is to stick close to the people who care about you, starting with your family and your close friends. And then as you're advocating, you're searching for people who are willing to listen to you. So many of the IgG4 patients I've worked with have expressed frustration that their doctors didn't take them seriously, that the doctors weren't willing to listen. Their doctors thought they were crazy. These folks aren't crazy. The situation is crazy, and our healthcare system doesn't work very efficiently sometimes. So it can be a very frustrating and maddening process, and it causes patients to be very frustrated with the healthcare system. Stick with the doctors who will take the time to listen. Stick with your doctors who care about you and show that they care and that they're in the journey with you, even if they don't know. They're willing to stick with you and take your concerns seriously and help you find out. And stick with your family who care about you and help you along the journey, because one person can't do this all alone. And as Kim mentioned, as an example about her wife, sticking with her and helping her through it, your close family members, the people who care about you, are vitally important during that journey of finding a diagnosis. Once you have a diagnosis, then everything we just heard about, the impact of community, is exactly what I see and what I experience myself and what I see patients experience over and over again, finding their people. And that's why a session like this is so very important and valuable.
Thank you, Dr. Friedman. That's really helpful advice for patients. So, looking back, Kim, what advice would you give to others with unexplained symptoms about speaking up and advocating for themselves?
Looking back on my own experience and my own diagnostic journey, advice that I would give someone who has unexplained symptoms or even just concerns about their current diagnosis or treatment, the biggest thing that I would say that you can do to advocate for yourself is to speak up and make sure your doctors know exactly how you're feeling and what you're thinking. I don't know if it was Donna, but earlier it was mentioned that your doctors are only as good as what you're able to tell them. So the more you can tell them, the better. And that includes both your physical and your mental health symptoms. It's always a good idea as well if you are not feeling like you're being listened to. As Dr. Friedman explained earlier, it's very important to have a doctor who you feel like is on your team and willing to listen to you. And if that's not the case, there is absolutely nothing wrong with getting a second opinion. But oftentimes it can be that the squeaky wheel gets the oil. So keep talking about things, keep bringing up these concerns that you have with your doctor, because they will eventually listen, or maybe they won't. And that means it's time to pivot to someone else.
Great advice. So ask the questions. Don't be afraid to hold back. Seek a second opinion, even if you need it. What can you add to that, Donna? What advice would you give to others with unexplained symptoms?
So the advice I would give to others is something, actually, I give a lot of this advice in my work life all the time as a nurse. And I always tell my patients, nobody knows your body better than you do. So if you are saying something is wrong, then something's wrong. You know, as a nurse, medical provider, it's our job to kind of help pull that out of patients and ask questions that can lead them, to better describe what's going on. So I that's the same thing that I do in my life, my personal life. I know my body better than my doctors do. I know what I'm feeling, and I may not understand how it connects to IgG4 related disease or not, but that's kind of not my role to figure all that out. My role is to bring that information to my physician and to work with him to kind of figure it out, because, he has all of that knowledge, the technical knowledge, and there's still so much of this disease that we don't know. And I have to remind myself of that sometimes too, that even though there isn't an answer, or, sometimes the answer is that we don't know, it's just really important to keep communicating and keep bringing the information forward, because it's only that way that we're all going to be able to figure this out.
And Donna, thank you. And you said something that I hadn't really thought about before. And you said it's your role. It's the patient's role to bring in that information. So what resonated with me as a patient myself too, not with IgG4 related disease, but with an autoimmune condition, I just related to that and thinking that it's our job as patients to not assume that the doctor knows everything that's in that file, and to ask the questions, to bring in the information, to alert them to things that you saw, maybe abnormalities and other things that you saw in lab work or in imaging or something like that, and ask for certain tests. If, sometimes we have to do the research ourselves too.
Absolutely. I mean, it's definitely important to have communication with your doctors and your providers. I mean, we don't live in a world anymore where this a couple generations ago, it'd be like, oh, the doctor knows everything and you don't question them. I have this conversation with some of my patients. I had this conversation with my father. It's like, you can't assume that stuff anymore. You have to be your own advocate, and you have to express to your providers, what is happening in your world and what's going on in your life and in your body and what your feelings are, and not assume that they know it all, because we don't know. Nobody knows it all. It's a collaboration between doctor and patient to really figure this journey out, any journey out in your healthcare.
It really is a collaboration. Thank you for sharing that. Thank you, Kim, Donna, and Dr. Friedman, for sharing your time, honesty, and experiences with us today. It takes courage to talk about the challenges of navigating a rare disease, and your stories shed light on what it really means to live through uncertainty, persistence, and the need for support. Your voices are not only a source of comfort and connection for other patients, but they also provide important insights for healthcare providers who want to better understand and support people living with IgG4-related disease. We're deeply grateful for your openness and the wisdom you've shared. This video was made possible with support from Amgen, and we are grateful for their partnership in helping us amplify patient voices and strengthen understanding in the healthcare community. Be sure to join us for the second part of this series, where we'll dive into the emotional impact of living with unanswered questions, the importance of support networks, and how healthcare providers can better recognize the psychological side of rare diseases like IgG4-related disease.